My name is Melissa Hinken. I work in the HR department. I'm going to speak with y'all today about the changes for the insurance plan, as well as I'm going to tell you a little bit about some of our supplemental coverages. And whenever I'm done speaking, a guy's going to get up and talk with y'all about our telemedicine program through ReadyMD, and he's going to do a live demonstration for y'all. So it's a great new benefit that the county started. It started about 1 year ago, and we all know what happened exactly 1 year ago, or just about 1 year ago. But it's really grown, and we've had a lot of employees and a lot of their dependents that have used the telemedicine. And so far, we've had nothing but great reviews for it. So he'll tell you about that. First Financial is here again, like they are every year. Heather is here. If you want to meet with her about the cancer plan that they offer, life insurance, also the flexible spending account, which is highly used by a lot of our employees and their dependents, definitely meet up with Heather following the presentation today. Also, Kristen has some of their forms, but Heather would be the best person for you to go to if you're making changes or want to add those plans.
And for the flex, it did go up to $2,650 this year, so $2,650. The last day to use your flex is December 15th. The last day to submit receipts is December 31st. So just make sure if you have flex, those are your deadlines.
Right. I met with an employee earlier this morning. She said, well, something's wrong because I'm going to my doctor's office and they're telling me I don't know anything anymore. She's on the buy-up plan. I said, well, it sounds like you've probably met your maximum out of pocket. And she said, oh, well, I have $600 left in my flexible spending. I told her, don't worry, save that, because come October 1st, your deductible and maximum out of pocket is going to start over, and you can still use your flexible spending on that. So that's probably what she's going to end up doing. Also, Barbara and her team is here again with Aflac. She's got the huge duck with her. Aflac is another highly used supplemental plan. Probably at least at one point in time, if not currently, everybody in HR has some part of a Aflac supplemental coverage. We love it, and they offer accidental, a hospital indemnity plan, cancer plan, and then some additional life insurance options, short-term disability.
And the best part is a one-day pay. How many of you have ever heard about an insurance company paying your claim? You file it one day and the money's in your account the next day. We know how important it is, so that money you can use to help towards your deductibles, your co-pays. It's entirely up to you. Go take yourself on a cruise.
Yes. And Bill Fondren is here. He's with Edward Jones. Edward Jones, their company can offer a plan for putting away for college tuition for your favorite kid or your favorite grandchild. Also, they do financial planning. So definitely, if you're interested in something like that, go see Bill. He's in the back.
And you can, because the county sponsors your 529 plan, you get to go in at NAV or at cost. And so it's a great resource for us.
Yep. And something else that the county has, a new benefit that the county has started this past year is MESA. And MESA is an additional benefit for ambulance, or air ambulance, or airplane ambulance.
Air or ground.
Air or ground. I actually just started my plan with them, and to cover myself and my family, it's $9 a month. This would have been very useful last year. We had one ambulance visit. It wasn't even an ambulance ride. It was one visit. They put some leads on one of my daughters and just gave her, a little safe place for a little while. After passing out on the ball field, she was fine. Just got a little overheated, but I got a bill for that. And this would have totally covered that bill and then some.
This is, just to kind of recap what it is, it's the emergency medical transportation, air or ground. Got a couple different plans. One is international, the other is domestic, meaning the United States and Canada. So I know a lot of you guys got the $9 one, for the domestic one. but we did have a enhancement to that. We now have the Emergent Plus, which includes repatriation, meaning a $10 worth will get you back home. So if you're, somewhere in California, Colorado on vacation or whatever, and you car wreck, heart attack, whatever, we not only pay for the trip to the hospital, doesn't matter which service transports you, but now we get you home with the enhancement. So if you want to upgrade, which a lot of people do, let me know and I'll walk you through it. Okay, and know that it covers for the $9 or $14, whichever one you choose, it covers you, the employee, your spouse or partner, and dependents up to age 26. So for the same 9 or 14, not per person. People want to get mixed up with that.
Okay. Thank you. Another benefit that we offer is called Legal Shield and Legal ID. Alicia's here representing them, and Legal Shield and Legal ID are a supplemental benefit for you to have if you just want some extra protection for your credit. If you
It gives you access to attorneys from everything from trivial to traumatic. We don't typically use attorneys because we're, cost. And so what this does, everybody should have one of these. It has little bullet points. If you use it for nothing else but just getting your wills and your medical directives, and that's for the whole family, then it more than covers the cost for several years. And on our ID theft, what it does is it monitors everything related to our identity, not just credit or financial issues, but our certificates, our certifications, our everything that's related to our identity. And how we're set apart is we actually have licensed investigators that do the restoration for you, so you don't have to have a restoration policy where they just reimburse you is what I meant. Reimbursement policy. They do the restoration for you.
Okay. And also we have a representative here again from Right Way Imaging. We started using Right Way Imaging last year, the year before. They came out and offered their services to us. If you use Right Way Imaging services, it does not get charged or submitted to your Aetna insurance as a claim. You would pay for that separately. And if you have a flexible spending card, then you can use your flexible spending account to pay for the imaging that they do. So they'll take some pictures of some arteries and various things in your body, and they will have a radiologist. I don't want to say the right.
Radiologist.
Okay, a radiologist
Yes.
will review it, and then the results are yours, and you can take them to a provider of your choosing to review them further if that is necessary. And he has some flyers for you, and he'll also have
To them and then talk to them after. Yes.
Are there just a few things that you'd like to add?
Yes,
Mhm.
real quick. Folks, this is an opportunity to do about $6,000 worth of tests. Because we work with large groups, we're able to bring the hospital to you. We're actually going to sit up here in this building on September the 10th and the 11th, offering all 9 tests, and all it costs is $159. I'm going to just kind of give these to each person on the end. Y'all just pass them around. I'll be available after the meeting. I don't want to take up too much time. But basically, we're just photographing the arteries and organs in your body. That goes to a radiologist. This is to identify people who are at risk for heart disease, stroke, and other vascular diseases before symptoms are present. I'll close with this real quick question. What does our doctor ask us every time we go see him or her? What's hurting? How can I help you? What's going on? Folks, if we can't tell them something's wrong, they can't fix it. So this is a way of identifying these crippling diseases before symptoms are present so your doctors can take care of them. Thank you so much.
Thank you. And I wanted to also mention something that y'all will all be receiving. You probably haven't received them yet, maybe you have, but you will all be receiving one of these little wallet cards. So you will get a card to carry with you, keep wherever you want to keep. And it's just a quick reference guide. It has in here information about some in-network urgent care, some in-network hospitals, as well as information on our telemedicine program. It tells you where to go for information on the employee assistance program that the county has. And it has the website for our two retirement plans, the TCDRS and the AUL. So you'll all be getting these. They are a good guide to keep with you. It also has on there, Aetna's 24-hour nurse line. If you're not really sure if you should make a doctor's appointment, go to an urgent care, go to an emergency room, use telemedicine, you can call the 24-hour nurse line, and they can maybe give you some guidance and tell you the best place for you to go to. So you'll all be getting these. You will get one for every person on your plan that is 18 or over. So if you have 5 kids and 3 of them are under the age of 10 and only 2 are over the age of 18, then you'll get 3 cards, one for you and one for each of the 18 or older kids. Okay? And those will come through interoffice mail. We're not passing them out while we're here.
And also, I wanted to add real quick, your AUL account, your alternate retirement account, Kathy Trussell will be here shortly. She's not here just yet, but she will be by the time you guys are ready to start talking. If you want to talk about your AUL account, she'll be right over here, okay?
Okay. All right, so let's get into the plan changes or some more information about your Aetna insurance. I put this in the presentation last year, and I wanted to be sure to leave it in there for this year, and that is that we are a self-funded plan. So what that means is, yes, we have an insurance in the sense that we use their network of providers for in-network care at discounted rates. Also, they administer our plan. So all of your claims information, all of your personal health information goes through Aetna. It doesn't go through HR. So we don't have access to who's going where and what they're going there for. We might see a general number that tells us, okay, well, 10 people went to this ER in this city during this amount of time, but we don't know who's going and for what. So they administer our plan and we use their network of doctors. So if you go to a doctor and you're on the buy-up plan and it's a regular family practitioner, then you pay your $40 copay. If what they billed to Aetna is $100, then just 60 of that is paid by the county. If you hit your deductible on the buy-up plan, it's $1,750, and on the HR plan, it's $2,750, which $1,000 of that goes from your health fund. You hit your deductible, and then you go to some more doctor's visits, maybe you have a surgery, something of that nature. You then just pay 20%, and the county pays the other 80% of the bill. Okay, so let's say that you met your deductible and you have a surgery, and the surgery costs, I gotta do something that's easy for me to do math, $1,000, right? So your part of the bill would be $200, and the county's part of the bill would be $800, okay? That's what that means. This slide is for the big insurance changes. If you picked up a benefits guide, you can go to page 10, I believe, in the guide, and it shows what these plan changes are. The biggest change for our plan this year is that there's no longer going to be any coverage for out-of-network care. Currently, it's a 50-50 split. So if you go to an out-of-network doctor, you pay 50% of the bill and the county pays the other 50%. But starting October 1st, there is no longer any portion for the county to pay. So you would pay 100% for out-of-network care. This is very important to remember and to take heed of it for whenever you go to your in-network doctor and they send labs out somewhere, or they refer you to another doctor, or they want you to go to a particular facility for a surgery, or they say, hey, why don't you go here to have this MRI done or CAT scan or whatever. Use the Aetna app on your phone. Make sure wherever they're sending your labs or wherever they're sending you for a referral, wherever they're sending you for imaging, that it is in-network. Met with another employee this morning. They had some labs sent out, $3,000. And this is their portion that the employee is responsible for. That's not the county's portion. That's just what the employee is responsible for. And it was an out-of-network lab facility. So had that employee gone to an in-network facility, the likelihood that that bill would not have been $3,000 is tremendous. So be sure you talk with them about that. Yes, ma'am.
Does carrier have that memo?
Does carrier have that? Oh, as far as who they're referring people out to, I don't know that they have an actual memo that says that.
You know what I'm saying? Do they know? Or do we still need that?
I know that the information has been given to them. Yep. And if it's been a recent issue or an ongoing issue, then that is something that we definitely will get straightened out. Yes. Wasn't aware of that, but we will
That's what I asked.
talk with them. Yeah, yeah. You know, and I remember going to care here a long time ago, so probably shortly after they opened, and I was being sent over to Brazosport for imaging, and the provider said, "Oh, don't worry about that. You don't have to pay for that, because I'm referring you." Well, I knew that that was not true, and that I was about to have to go pay for that, and I let her know, and so. Again, anytime that you have an issue like that, please let us know, and we will contact them and get it straight. And you know that I'll definitely check into it for you, right? Okay, good question. So be sure to talk with your providers. Make sure that you are using in-network services. Most pharmacies are in the Aetna network. Walgreens, CVS, Kroger, Walmart, Albertsons, most of the big grocery stores that have a pharmacy, they are in the Aetna network. I know that we have a lot of pharmacies that are not part of a chain, and we have some local ones here in Pearland also that are in network. It's probably hard to find a pharmacy that's not in the Aetna network, but just double check and make sure. If you go to Walgreens or CVS, it could potentially be a little bit costlier than going to Walmart or Kroger, but I don't think it's going to be some huge amount. Okay, any questions on the out-of-network piece? Okay. The ER copay is going to be $500 on both plans. It has gone up from $250 to $500, and that is effective October 1st. All the changes that we talk about today are effective October 1st. The HRA plan at this point has never had a copay, but it will now with ER trips. I cannot guarantee how facilities, doctor's offices, and so on and so forth are going to charge you, and what they're going to say, you have to pay me this before you can get treated. We don't have control over that. Sorry, but if you are on the HRA plan and you have money in your health fund, the $500 can come from that. But a thing with a copay, to remember if you're on the HRA plan, copays do not hit your deductible. They do go towards your maximum out of pocket, but copays do not hit your deductible. Any questions on that? If you go to the emergency room and you are admitted into the hospital for a stay, an actual admission, just not staying in the ER for the night, but an actual admission, the $500 copay is waived. Other than the amount, that's nothing new. The ER copay has always been waived if you are admitted. And then the hospital, there is an admission fee for the hospital, and it's $200, and that's staying the same. Okay. Another change to the plan this year is the individual maximum out of pocket for in-network care is going up from $3,500 to $5,000. Also, the family maximum out of pocket is going up from what it currently is on the buy-up plan to $14.7. Other than the ER copay, there are no changes on the HRA plan. There's no changes in your monthly premiums, and there's no changes to the maximum out-of-pocket limits or the deductible limits. Everything's staying the same on that plan. The buy-up plan is the one with these changes. So a question that we get a lot, I'm sure Sheree gets it the most, is, well, what if I just cover myself and my spouse, or myself and one of my children? What's my maximum out of pocket? What's my deductible for a family? The term family in the eyes of Aetna is 3 or more people. So if it's just 2 people, then you take the individual deductible and the individual maximum out of pocket, and you multiply it by 2. So it will just be $10,000 maximum out of pocket on both plans. Any questions about deductibles and maximum out of pockets? Oh, thank you. Okay, and then the monthly premiums for the buy-up plan are increasing by $20 a month, so $10 extra a pay period for the buy-up plan. There are no rate changes for the HRA plan. So if you are on the HRA and you're just covering yourself, it'll continue to be $0. And the same as it applies to family, spouse, and children. Okay, so you know you have the 2 different plans to choose from, the health reimbursement account and the buy-up plan. So some things that they have in common is they use the same network of providers. So no matter which plan you go on, the same in-network doctors are going to be the same in-network doctors, and the same for pharmacy, and the same for labs. Anything that's in-network on the buy-up is in-network on the HRA plan. Also, your dental and vision benefits work the same on both plans. Dental and vision do not come out of your health fund on the HRA. There might be some situations that they're doing some sort of dental work that gets coded as a medical event. And then in that event, it will be taken from your health fund, but only in that situation. So routine care, root canals, caps, orthodontic services, cleanings, none of that touches the health fund. Well, the cleanings are free on both plans as long as you're going to an in-network dentist. You'll get 2 free cleanings a year. Okay, and then vision, for your 1 routine eye exam, it is free to you. I know that we had a lot of phone calls, or Sheree had a lot of phone calls in the past year because people were getting charged a copay for having just the routine eye exam. You should not have to pay anything. Now, if they do the extra dilation and then some extra stuff, then that's where you start getting into extra charges that you would be responsible for. But 1 routine eye exam is covered 100% because it's considered preventative care, and all preventative care is covered 100% on our plan.
And just to add to that real quick, on the Aetna Vision, it's just the eye.
Okay, so is this before the buy-up? Is the buy-up after this? Okay. So on the HRA plan, if you go to a doctor's office, there's not a copay. You pay the Aetna member rate for that doctor's office visit. So if your doctor's office would normally have sent a bill to the plan for $100, that's how much you would pay. And it would first come out of your health fund, but once you reach your health fund limit, then you would start paying the Aetna member rate for that doctor's office visit. I think we've had the plan for 3 years now, or we're going into our 3rd year. Okay. One time, one of the doctor's offices that I went to required payment up front. And this was just like a regular family practitioner. But that happened to me one time. And we've heard here and there of it happening to some of the other employees of the county as well, but it's not really common. So what happens in that situation, or what happened in my situation, was the doctor's office wanted me to go ahead and pay up front, which I did, and then they billed it through Aetna. Aetna paid the doctor's office, and then a while later, I received a check in the mail from the doctor's office, and that's the typical procedure for something like that.
The first thing you should do is if you have an HR account, a brand new account, first thing out of your mouth when you go to the doctor's, I have a health reimbursement account. Because they're not going to know up front. And so if you tell the girl, hey, I have an account, then that'll hear that, okay, this is coming out of your account. If you just go and give them your insurance card, just give them that little extra verbal prompt, and that'll help you. You got to train them because they're not used to, your account. So that you help them and they'll help you.
Yeah, and sometimes they just have different procedures of how and when they're going to file. And in my situation, I did let them know, and they just wanted me to go ahead and pay, and then they were going to file it through the insurance after that. So that's how it goes sometimes, I guess. Okay. Sorry. $1,000 for an individual coverage into your health fund, and then a family. So in this situation, when I say family, I mean 2 or more people that you're covering. It's a $2,000 health fund that you get. I cover myself and my 2 kids, so we get the $2,000. All right. So then the buy-up plan. Go ahead and switch to the next one. Yep. Nope. That one.
Sorry.
That's okay. Okay. So the buy-up plan is the more traditional plan, and that's the one where you go to a doctor's office visit, you go pick up a prescription, you are going to have a copay. Co-pays do not go towards your deductible. They are going towards your maximum out of pocket, but not towards your deductible. On the buy-up plan, there is an individual maximum out of pocket of $5,000. So let's say you hit that. You had a surgery or some big event that happened and you hit the $5,000. And it's, July, and you've already hit your $5,000. But you still have some follow-up visits. You still have prescriptions that you're going to have to pick up. There's another maximum out of pocket that you would then hit, or that would apply, but that's only for copays. So if you have a surgery early in the year, let's say in January, and you hit your maximum out of pocket, and you then end up having to have another surgery a couple of months later, you don't pay for that surgery as long as everything's in network. You don't pay for that, but your follow-up doctor's visits and then your prescriptions that you're on, you pay your normal copays for that. Does that make sense? Okay. And if y'all still have more questions after we're done, please come up and ask me, Kristen, and Cherie. We can explain it further to you if we need to. So that's the huge difference between the 2 plans. One has copays and one doesn't. One you're paying the actual cost, the Aetna member rate, for your in-network provider, and your in-network pharmacy, and your in-network labs. Okay, the Aetna Navigator. This app is very useful. The worst thing about this Aetna app is that you have to remember another password. Okay. Okay, well, it's not going to pull up on my phone in here. But other than that, I love this app. I go to it quite often, and it really saved me some time. Literally, when a couple of years ago, my family, we were in South Carolina for a softball tournament, and I got sick. And this was before we had telemedicine. I needed to find a doctor's office, an urgent care to go to. So I used my Aetna app. I need to find immediate care, and I found an urgent care facility that was about a 10-minute drive from where we were staying. And I got in, and then they called in my prescription to the local CVS. Everything was in network, and it was extremely helpful. So the next year, another softball tournament, different state. One of my children, who I won't name because I don't want to embarrass her, had like the exorcist scene with the spinning head and vomiting and all that. That was her. And we needed to find immediate care. And I was actually at home. So I found an in-network urgent care provider right around the corner from where my husband and my children were staying in Florida. I wanted to be sure to tell y'all that so that everybody understands that Aetna has a large network of providers. This is not just something offered in Brazoria County or in Texas. They are all across the United States. Okay, so wherever you are, you can find or the likelihood is great that you would be able to find an in-network provider, in-network urgent care, so on and so forth. And now we have the telemedicine, so if you happen to be in Alaska and you get sick or you're not feeling well, then you can call telemedicine. And they can either do a phone call doctor's visit with you or a Skype doctor's visit with you, and you get charged nothing. Our telemedicine program is 100% free to employees. Yep. Okay. I'll just talk about it, but let's not go to it.
You want to go back?
Yeah. Okay, so we have something, I came up with this in 2015 whenever we were switching to the options of the buy-up and the HRA plan. I did it for myself because I see if you can click on it to show them it. The link didn't work earlier. Okay, and then go over to sheet 1. Okay, good. I wanted to be able to look at it in black and white to figure out which plan was going to be better for myself. And so I came up with this spreadsheet. I have a column for what this cost me on the HRA plan and what this cost me on the buy-up plan. Because I wanted to see at the end of the year which plan would have paid more to. And it worked out that the best plan to be on was the HRA plan. So these are just some examples of doctors' facilities, and I threw in some chiropractor and then some medications, so on and so forth. And then you can see the difference of what it would have cost this person on each separate plan. So at the bottom, it says total paid out of pocket for year for HRA and total paid out of pocket for year for buy-up. So if this was a typical year for somebody on the HRA plan, including premiums, so including what you pay monthly to cover whoever, it would have been, let's say, $2,500 on the HRA plan for all your medical visits, prescriptions, and premiums. On the buy-up plan, about $4,500. Okay, that's a huge difference. So if y'all want access to this worksheet to help you figure out which plan would work best for you, it is on our MyBC page. And if you don't know what that is okay. We can give you the link to it, but it's really easy. It's MyBC / which way? Do you know? Forward? Okay. And if you're at work, you're on the county computer, then you can get to MyBC, click on the HRA link, the HR link, and then you'll see our list of documents there, and this worksheet is in the open enrollment folder. Okay. We've had some employees tell us over the past couple of years, oh, I just want to stay on the buy-up because it's just easy. It's what I'm used to. I understand that it feels safe. It's what we're used to doing. And then we sit down with them and we do the math, and the HRA could have saved them a lot of money. And you roll over what you don't spend on the HRA plan every year. So if you cover a family and y'all had a great year, you use the benefits that the county gives you as far as telemedicine goes, the employee health clinic. You could potentially roll over the majority, if not all, of your health fund. And it continues to build each year. There is no cap on it. And then that way, if something traumatic happens next year, then you have more money to go towards that medical event.
Does that include the flex infield?
No, Flex is totally separate.
No, in the calculation.
Did I?
The Flex spending card? No.
No, on this sheet, worksheet.
No, I did not put, are you talking about the flexible spending cards that we have?
Yeah, on that sheet to figure out how much. if
No.
you have the flex in there.
No, but it's in Excel, so you can add it in. Yeah, you can add it in and make changes. All right. Okay, so some ways to save on our healthcare costs. Assistant surgeons. Prior to having a surgery done, talk with your doctor and make sure that any of their assistant surgeons that are coming in to help are going to be in network, in the Aetna network. If you do your homework, if you go to an in-network doctor and you are going to an in-network surgery center or an in-network hospital, and you know that your doctor said that this is my assistant surgeon that's going to be there, and they're in network, and then another assistant surgeon comes in and that one is out of network, don't pay that bill before first talking with Aetna and talking with HR, with Cherie, okay? Because it's possible that we could get it billed for you at a cheaper rate, more like the Aetna member rate that you pay for your doctor and the other in-network assistant surgeon. Okay, but if you go to an in-network doctor and and you and your doctor set up that you're going to have the surgery done in an out-of-network facility, and then an out-of-network assistant surgeon comes in, you're going to pay for the out-of-network fees. You'll pay for that doctor and for that facility. So please have this discussion with your providers and make sure that you're using in-network facilities. Quest instead of LabCorp, and the Quest in Lake Jackson is over by Cherryberry, right? Or Tractor Supply, that area. If you go to your doctor's office, pay attention to the signs that they have up. I went to a doctor's office just the other day and they had on there, please tell me, would you like your lab sent to Quest or LabCorp? And if they would have had labs order, I would have said Quest, please Quest. Also, if you're able to, avoid ERs and avoid standalone ERs. I'm not here to replace the advice of a medical provider, but what I can tell you is that if you have a sinus infection, okay, we'll make it easy. If you have a sinus infection and you go to an emergency room for that sinus infection, you're going to pay a whole lot more in the end than if you went to your primary care physician or used the clinic or used telemedicine for that same sinus infection, okay? So it's things like that that we can do to change. And with our telemedicine provider, things like sinus infections, they treated some employees and their dependents who had the flu during that nasty flu outbreak this year. It's free, right? Okay, and then of course, urgent cares are cheaper than ERs. In the employee health clinic, if you go to the employee health clinic, there is no copay, there is no fee for you, and if you're going during your normal work schedule, your sick time is not charged. Yes, ma'am?
Just one thing, anything that has an emergency in the name, that is not an emergency. So it's a little easier way to sort of check it.
Okay, and one other thing too, and other than the stay in network, this might be the most important thing. Whenever you go to your doctor's office and they prescribe you a medication, ask them, is there a generic available for this medication? Sometimes there's not, right? And sometimes you might have already tried a generic, and between you and the doctor, y'all realize that the brand name or the specialty, whatnot, works best for you. But what if a generic would work better for you? Right? If you're on the buy-up plan, you have $150 deductible for prescriptions, and if you're getting a specialty, every time you get that medication, it's $150, right? If you're on the HRA plan and you're on a specialty medication, most likely you're going to be meeting your maximum out of pocket every year. So if you're on a brand name drug and there is by chance a generic available, you could potentially save yourself hundreds or even thousands of dollars by just asking that simple question. And sometimes it's even hard for me to remember to do that, right? And this happened to me just the other day. I went to a doctor, they prescribed some medication, didn't ask anything about a generic, and I'm realizing this as I'm driving to the pharmacy and I'm in a panic. I'm like, oh my God, what if it's a compound? What if it's a specialty or something? So whenever I got to the pharmacy, I asked them, what is the charge going to be? Because I wasn't going to get it if it was going to be some astronomical amount. And they were able to look it up and tell me what the Aetna member rate was, what was being billed to Aetna. And so I went on ahead and got the information and then got the medication. So please remember that it is very important to ask your doctors about things of that nature. Uh-huh.
If you guys get a prescription, especially on the HRA, a lot of times they call them in and they go directly to the pharmacy and you just go and pick it up. Please look at the cost before you leave the pharmacy person. I had a lady call me up and it's $750. She got home, she didn't think about it, she freaked out. But once you've left that pharmacy, they won't take it back. So it's better just to like hold off for a day or so and let's check it out and see if, like she said, get a generic or something. But just want to FYI that has happened. So I just wanted to.
Do you know they take coupons?
Excuse me?
Yes, they do.
Yeah.
Yep.
But they don't, but they do.
Well, some prescriptions you can do either or. Like, you know, you can use the prescription, a discount card and not use your insurance, it's cheaper. And then some of them they run through. So a lot of times the pharmacies will help you.
They're like, oh no, it's free, don't worry about it, yeah.
Yeah.
Oh,
That's the story about that.
that's for free.
Not me. Yeah, not me, somebody else.
Yes.
Yeah, it was like, it was free, because they were in the HRA, they didn't want to take the coupon. No, we don't need it, you don't need it because it's free, it's already been taken care of. Then $1,200 later on that prescription.
Oh, yeah.
By October 15, her HRA, the HRA was ate up.
Oh, yeah, see?
Yeah, because they wouldn't take that coupon for $50
Wow.
for the cost.
Which
Yeah.
pharmacy was it?
Brokers?
Yeah. Great example. Just have that discussion with them and
Yeah.
Wow.
tell them how you want it charged. Okay. And just one more thing, because we already talked about that last thing. The Aetna website has a lot of great information, and it can tell you who's in network and who's out of network. So use the Aetna website, download the Aetna app, and you could potentially save yourself a lot of money. Is that it, Kristen? Okay. So with that being said, I'm done as far as the changes to our plan and just the differences of the two plans. We are also, now y'all are going to get some more information about our telemedicine program, and hopefully we'll be able to do a live demonstration for y'all.